Hello, today Paige Harai and Orpha Menendez will be presenting on how to manage a patient with rheumatoid arthritis in a dental setting. First, we can define what rheumatoid arthritis is. So, rheumatoid arthritis is an autoimmune and chronic disease in which the immune system attacks healthy cells by mistake, causing inflammation in the affected parts of the body. It can attack many places at once, such as the hands, wrists, and knees. A patient with rheumatoid arthritis may present with the following signs and symptoms, such as significant joint inflammation, morning stiffness lasting longer than an hour, limited or difficulty opening of the mouth, muscle aches, fatigue, weakness, malaise, and TMJ involvement. A potential long-term complication of chronic rheumatoid arthritis is the ultimate destruction of particular joint structures. According to the American Dental Association, they advise patients with prosthetic joints are not recommended to receive prophylactic antibiotics prior to their dental treatment. Each patient is different, so please consult their orthopedic surgeon. The picture shown here is what a healthy joint looks like on the left, and on the right is what it looks like on a patient with rheumatoid arthritis. It can potentially need to be replaced with synthetic materials. The most commonly used medications are non-steroidal anti-inflammatory drugs, salicylates, and corticosteroids. Patients taking corticosteroids are recommended to consult their physician prior to dental treatment because they have an increased risk for infections. The most common implications that arise from these medications are oral ulceration, stomatitis, adrenal suppression, prolonged bleeding, impaired and delayed healing, glossitis, intraoral pigmentation, and as we mentioned earlier, an increased risk for infections.
For the dental management of a patient with rheumatoid arthritis, afternoon appointments are recommended. This allows morning stiffness to go away by the time of treatment. The patient should also be seated in a position that is most comfortable for them and be allowed to make position changes when needed, as well as use supports. Having the patient come in for shorter, more frequent appointments will help to reduce their risk of periodontal problems. Patients with rheumatoid arthritis are most commonly affected in the joints of their hands, which limits their dexterity. Because of this, electric toothbrushes, bulky attachments for the handle of manual toothbrushes, floss holders, toothpicks, and irrigating devices should be recommended. Fluoride treatments and mouth rinses will also be beneficial. All of these things will help to improve the oral hygiene of these patients. When is it best to treat a patient with rheumatoid arthritis? What are the effects of rheumatoid arthritis on the mouth?